But these treatments can also cost quite a lot of money. And if they're not going to be affordable, then it may be that actually having a more radical surgery is going to offer your dog the best chance of a successful recovery and even cure from their cancer.
Welcome to the Call the Vet Show, the podcast that helps keep your furry family as healthy as possible so they can live the full and happy life they deserve. And here's your host, veterinarian Dr. Alex Avery.
Now, a cancer diagnosis is not what anybody wants for their pet, and you can quickly be faced with some pretty challenging and almost seemingly impossible decisions to make, and decisions that need to be made really pretty quickly if your pet is going to have the best chance of recovering from their disease. And that's really what I'm talking about today. But before I get into today's question, which was sent in by Joe, welcome along to another episode of the Call the Vet Show. If we've not met before, then my name is Dr. Alex and I'm the veterinarian behind ourpetshealth.com. And this is the podcast for all pet owners who want to optimize their pet's health so that they can live the full and happy life that they deserve. So welcome along and make sure you hit that subscribe button if that sounds a little bit like you. But let's not waste any more time. Here's today's question.
I'd like to know if a dog has a cancerous cyst on the leg, on the front paw, does the whole leg have to be removed?
So I'm sorry you're being faced with this decision, Joe. A cancer diagnosis is not something that any pet owner wants to have to deal with. If we're thinking of cancers at the end of legs or anywhere on a leg, really, there are a few key things that we need to consider when it comes to knowing what the best treatment option is. And that could be surgical. It could also be medical. And very often it's a combination of both. So the first thing we need to know is actually what type of tumor is actually present. So that's really significant, because if we're dealing with a benign, so a type of cancer that doesn't spread, a benign tumor that doesn't tend to infiltrate into the local area as well, then that can be something that we could potentially remove very comfortably in a simple surgery that doesn't need anything particularly clever being done. If we're dealing with a more aggressive, locally invasive tumor, and by that I mean it effectively kind of sends tentacles into the surrounding tissue, it could be very challenging to remove those in their entirety. So that needs a much more radical surgery, removing a much larger area than may seem apparent when you first feel that lump and the size of the lump, because microscopically there's lots of cancer cells actually going deeper into the surrounding tissue. And then if we're dealing with a particularly a locally aggressive tumor, or one with a high potential to spread, or a tumor that is known to cause an awful lot of pain, so I'm thinking here more like an osteosarcoma, which is a tumor of the bone rather than a cyst-like skin tumor, then amputation definitely might be the best way to successfully remove that tumor. The other thing we need to think about is actually what size that lump is, and that's going to be important when it comes to surgical planning. We need to know exactly where on the leg that tumour is. So I can't make a recommendation based on a simple description. You need to be able to know where it is, have a good feel, know how big it is, what is the tissue around that tumour like. We also need to think about whether any follow-up treatment is going to be possible or is appropriate for that tumour type. So is chemotherapy going to be an option for you and your dog? Is radiotherapy going to be an option? That's something that is becoming a little bit more common, although the availability is still pretty limited. So that's going to depend on the parts of the world that you live in. But these treatments can also cost quite a lot of money. And if they're not going to be affordable, then it may be that actually having a more radical surgery is going to offer your dog the best chance of a successful recovery and even cure from their cancer. When it comes to deciding the best surgery for your dog and the best treatment overall as well, we also need to consider whether that cancer has spread. So if we are dealing with a nastier, more aggressive, more malignant tumour, we need to do something called staging. So that is a way of trying to determine whether the cancer has spread to other parts of the body. Because if it has already spread to the lungs or to other lymph nodes, other parts of the body, then actually aggressive surgical removal of a whole leg may be less appropriate. Because the last thing we want to do is to put a dog through a major surgery if actually they're not going to have a major problem because of that tumour on their leg, and removing it is not going to remove the cancer from their body as a whole. So staging can involve taking samples from the lymph nodes. It can also involve x-rays of the lungs. It can involve ultrasound examination of the abdominal contents to see if there's any sign of other cancer developing elsewhere within the body. Because like I say, if it is, then that will have an impact on the treatment options that are going to be best for your dog. Now, one thing to bear in mind is that cancer treatment and the whole field of oncology has grown and developed very rapidly over the last several decades, probably, but the last 10 years, there's been massive changes. So it can be really important to make sure that you are talking to a vet who is up to date with their recommendations, or ideally actually seeking specialist intervention, especially if it appears that you're dealing with a tumour that is more aggressive. They are much more likely to be able to give you an idea of what the prognosis, what the likely outcome is with each treatment option. They're going to know much more detail about the potential for radiotherapy. They're also going to know if there are any new chemotherapy protocols around. So a lot of chemotherapy protocols involve injectable drugs, which need to be given very regularly, and clearly they need to be given by a veterinarian. There are more what we call metronomic chemotherapy protocols coming out, which are oral treatments. So you can give them at home. They are potentially safer, come with fewer side effects, and maybe just as effective. But again, that really depends on the type of cancer that's being dealt with. So that's really where referral to a specialist oncologist can be really beneficial. Now, if you're facing the prospect of amputation because of cancer in your dog, I've got a fantastic interview with the team at Tripod, so Renee and Jim, who have a brilliant, supportive, informative community all about dogs who have lost a leg for a number of different reasons, but cancer is the big reason. You can check that out at episode number 74 of the Call the Vet podcast, and I'll leave links in the show notes for that as well. So if you are facing that difficult decision, that's definitely a resource that you should consider tapping into and will really help support you in your decision-making process in the first instance. But if you do then proceed with amputation, it will help make sure that your tripod, your three-legged dog, is living their life with their full potential. So as well as that previous episode of the podcast, that fantastic interview that I did with Renee and Jim, I'll also leave in the show notes links to other information about different topics involving cancer, how to tell whether a lump is cancerous, and various other important pieces of information that are really going to help you if you're faced with this difficult decision. And then all that's left for me to say today is to make sure you hit that subscribe button on whichever podcasting app you're listening to. I've got a lot more fantastic questions and interviews and information coming up on the show. And until next time, I'm veterinarian Dr. Alex. This is the Call the Vet show. Take care.
Thanks for listening to Call the Vet. For full show notes and any links mentioned in today's show, head over to callthevet.org. where you can also submit your question to be featured on an upcoming episode. We'll see you next time.